Hey guys, welcome to Endo Warriors. I'm your host, Callie Greenberg, and this is where we have unfiltered conversations about endometriosis, women's health, and what it's actually like living with a chronic illness. So grab your glass of wine and let's get into it. All right, welcome to another episode of Endo Warriors podcast. I'm your host, Callie Greenberg, and my guest today is Dala McDevitt, and she is a registered nurse, fitness and nutrition coach, founder of the insane DLDNation, and someone who has been incredibly open about living with endometriosis and infertility, while also building a meaningful career and community. So, Dala, welcome to the show. I'm so happy you're here.
Yes, thank you for having me. Thanks for the introduction.
Oh, yeah. So this conversation, I think, will really resonate with a lot of people, regardless of whether or not you have endo or if you have chronic illness or you're just struggling with your body in general. So before DLDNation and online programs in the community, you were a labor and nurse delivery.
Yes, labor and delivery nurse.
Sorry.
Yes.
Yeah, I have dyslexia, so I just said that completely wrong. But you get my gif. And I work in an OR, so I know how taxing being a nurse can be, not just physically, but emotionally. So how did being a nurse affect you and your relationship with yourself and with healthcare?
Nursing, even though I loved labor and delivery, just in terms of the personal self-care, it got really hard. I was a nurse for 5 years and I started doing some coaching on the side. And I would have days during the week where I was able to focus on coaching instead and just have the juxtaposition of what does a day at the hospital feel like versus what does a day of being at home and working for myself feel like. And I would tell my partner when he got home, I'd be like, I ate food today. And when I was thirsty, I drank water. And
people don't understand that.
I peed more than twice. It was just wild because I loved the work and I loved the patients, but it was so exhausting. I was, gosh, how old was I? 26. So I was not old by any stretch of the imagination.
Right.
Mid-20s, should have all the energy in the world. And I was running my body into the ground because it was just they call it a 12-hour shift, but it's really 13 hours all in. And then we got lunch breaks 30% of the time on my unit because we were chronically understaffed and always busy. In an L&D, emergencies happen. And it doesn't matter if it's time for lunch. Those babies are coming on their schedule, not yours.
Totally.
And yeah, that was definitely a big factor that pushed me even more to want to go pursue my business, because I was like, I don't think I can do this for decades. I don't see how I could have kids, get older, and be 50 years old, putting in this physical daily effort.
I relate to that so much because even as a med device sales rep, first off, people do not understand my job. It's really funny trying to explain to them what I do because they're like, but you don't have, you're not a doctor. You're not a nurse. So what are you doing in the operating room? And I'm like, that's a different story for a different time. But I will tell you, I respect nurses so much. The staff that I work with works their butt off. People think that it's just sitting around or oh, every now and then I have to go check on a patient. We, including me, are on our feet all day and we are running back and forth, sit down, stand up. And when I first started in my job, right. And here's the thing, I don't get tapped out. I don't have somebody to come in after hour 5 to be go eat some lunch. So I'm there throughout the entire procedure, not drinking water, not eating, not taking care of my body. And it wreaks havoc on your system.
Yeah.
And gosh, I mean, that's all. It's just so difficult. I remember I got shin splints when I first started.
Yeah.
I had no idea that I wasn't going to be able to take a break and go to the bathroom because I'm in spine deformity cases. And so my body had to adjust to not drinking water, not eating for 14 hours, and it throws your system completely off.
Yeah.
So, while you're doing this job and thinking, okay, I'm having a difficult time and I'm struggling and pushing your body probably past what it could handle. At what point did you feel like your body was disconnected from your heart, from your head, and that like just pushing through wasn't enough anymore? Like you needed to make a change.
Yeah, that was probably in like year 4 to 5. Years like 1 to 3, I was so fascinated and absorbing that you're just kind of not thinking about it. You're also new, so you're paying your dues. You're trying to earn the respect of everybody on the unit. But once I'd been there for 3 years, at least where I worked, that categorized me as seasoned. I started
Mhm.
precepting new nurses. I was no longer green, and that's when I really I kind of settled into the job more. And that's whenever I became a lot more aware of like how difficult it was. And, my partner would just call me like a zombie. And then, you have a day off of work and everyone's like, oh, but you get like an entire Tuesday off work. Isn't that amazing when you work 12s? I would spend the entire Tuesday in bed.
Yeah,
Like especially if I worked like 2 or 3 in a row, that next day is just like horizontal recovery time.
totally.
And that was
There's
kind of
no
when I
day
got to the
off.
point. Yeah. That was kind of when
I
I
mean, like,
started
you
to
don't
get
get
to
to
the
go
point
run
of like,
errands and yeah, you don't get to, like, do like a, "Okay, I have to do this, this, and this," because you're so tired, so yeah, you bed rot, basically.
yeah. Yeah. And I just thought, like, again, I just kept thinking, like, I'm really young to be feeling this way. Like, I'm 25, 26 years old. And I'm like, I don't know if I can keep up with this job anymore. And I feel like most 25-year-olds, 26-year-olds could do anything.
I
You could,
agree.
like, that at that age, you're like going to the club, drinking till 2 a.m., waking up at 5 for work, and you can
Like,
usually
"Let's
like
do it
power through a
again."
day. Yeah. But and probably one of the things that was becoming challenging for me too, that I still deal with to this day, is I have bladder issues from being a
Okay,
nurse. And
yeah.
when I started to realize that I was like developing like chronic health issues, that definitely was like a little bit of like, an orange flag, if you will, yellow
Mhm.
flag. Because I had gone so many times of having to go to the bathroom and not being able to go to the bathroom, that I started having like bladder spasms and like, difficulty emptying all the way, having to go to the bathroom, having to go to the bathroom again 5 seconds later. And I was like, I haven't had babies yet. These are the kind of things that I've heard women describe, maybe who've had numerous kids and who are older, and I'm 25 and I'm having a hard time controlling my bladder over here. I did not know at the time that I had endo. So, there's all kinds of variables going on down there that were probably worsening that. But that
Mhm.
was another one where I was like, I love this job, but I don't know if I'm willing to develop like more chronic health issues for
Yeah.
it.
And again, like you just said, that disconnection becomes even heavier when your body starts sending signals that something isn't right. So
Yeah.
we connected on Instagram. And like I said in the introduction, you've shared openly about your experience living with endo. So can you take us back to when you first realized something wasn't right? Like seriously wasn't right.
Yeah, so that was in my infertility journey. I will say,
Okay.
like, I did not realize that I needed to go get looked at for endo prior to infertility. I was also the person who got advised to get on birth control at 15 years old. And I was on
Yeah.
birth control for 11 years before I stopped. And what I now know is that while birth control is not a treatment for endo, it may suppress lesions and symptoms because of the exogenous
Mhm.
hormone effect. So I think that I was not super conscientious of my endo for a while because of the suppression. My whole system was shut down. I didn't ovulate for over a decade. Um, and then I think what actually really sparked my endo up was
Mhm.
having a baby. I had my first baby and I did IVF treatments which makes your estrogen go into the thousands and thousands. Like an egg retrieval, your estrogen will be 3,000, 4,000, no problem. And I had
Mhm.
done multiple egg retrievals. I had also done multiple transfer cycles where they're pumping you with estrogen orally, vaginally,
Mhm.
patches, just meds, 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 meds. And all of that, it can be really triggering for endo. Then thankfully I was able to have my first son, and postpartum I had really bad endo belly, which I now know was endo belly. And I was super confused. I was like, is this my uterus? Is this diastasis recti? My belly hurts. I don't want to wear jeans. I'm really uncomfortable. Like, how are other women wearing tight clothes? Tight clothes are like, I can't do that. Anything that touched my lower belly was so horribly uncomfortable. And even once I returned to like a healthy body weight, I look in the mirror and I was just like, that doesn't make sense with like the upper body and the lower body and the exercise that I do. None of that makes sense. And
Mhm.
it wasn't until I did suppression in an IVF cycle. We use like Lupron. Sometimes in IVF cycles, they'll use like 2 to 3 months of Lupron
I don't know
depot.
what your experience with Lupron was, but let me tell you, my experience with it was hell.
Yes. Well, it puts you into instantaneous menopause for those who don't know. So it takes in my case, 34-year-old woman, and it puts you in menopause within a couple of weeks. It shuts down everything.
Yeah.
My estrogen levels were so low that they could not be detected. They were not presented in a numerical value. They just
Yep.
resulted as less than 5 because it was so small that like the machine couldn't even pick it up. So
Mhm.
you're in menopause overnight, but my endo belly went away and my belly didn't hurt because
Inflammation.
Lupron shrinks the lesions that you have. And so like, yes, the menopause symptoms were horrific and they were just so instantaneous,
Mhm.
like no slow build. It's like overnight.
Oh, yeah.
But once I did suppression and I noticed the difference in my body, that's when I really, really suspected that I had endo, which a couple months later was confirmed and excised by a surgeon.
Okay. Um, God, Lupron. I literally had this conversation with, my guest last week and just talking about how I think Lupron should be taken off of the market. Like, I get what it does, but, like, you can correct me if I'm wrong. I'm not 100% sure, but I'm pretty sure that the drug initially is meant for cancer.
Yes,
Yeah.
estrogen driven cancers.
Yeah. So, and it's hella expensive. If
It's
anybody out
very
there
expensive.
has that, it's ridiculous. I don't understand. And like you did multiple rounds. And so, yeah, that, like you just said, I mean, the first shot that I gave myself of Lupron, I think the next day I woke up and was migraine, night sweats, anxiety, stomach ache. It just awful experience. But so here you are, you're going through your IVF journey. You are knowledgeable about medicine, feeling that something isn't right. And as we know, anybody who is listening or anybody who's been through this experience just with endo, dismissed, not believed. And here you are as a medical professional. And did you feel like, okay, I'm a nurse, I speak the language, so advocating for myself is going to be pretty easy because, like, I I get them, like, they don't have to dumb it down? Or was it more frustrating because I don't know if you feel this way, but as somebody who is in healthcare, it's like we know too much, so our expectations are higher because of what we know being on the inside. So when you are being dismissed or just told everything's normal, it's almost more frustrating because you're like, wait a second, I know something else is going on. I speak your language. So, like, did you find your experience to be more frustrating or like easier to advocate for yourself?
So I didn't personally feel as frustrated because I knew what to do being in healthcare. and I knew how to advocate for myself. And so that gave me personally confidence.
Mhm.
My experience with endo made me think like average people do not understand how much you have to advocate for yourself in the medical field. Listening to your doctor, one provider, one random provider that maybe your insurance just referred you to
Mhm.
or was just proximal to where you live is not enough. And like that's what was really like scary and daunting to me is because I was willing to have my doctor tell me, you don't have endo. I had a doctor tell me, like, I'm really quick to call on endo cases because I was struggling with infertility. And I was like, can we talk about endo? And they're like,
Mhm.
you don't have endo. And so I was like, I'm gonna go find an endo surgeon because I just like I knew and I had insurance where I didn't have an HMO. I knew that I had a PPO, which I always get because I know how much I need to advocate for myself. And I honestly don't even always trust my providers to make referrals for me when I need them, which is
Mhm.
sad.
So
So
sad.
I went and I found myself an endo surgeon. And I even drove to Dallas. I live in Austin, but there's only like a couple good endo surgeons in Austin. In Dallas and Houston, there are a lot more. So
Okay.
I researched endo surgeons on my own, no doctor referral, no friend referrals, no information. And then I scheduled consultations with like multiple endo surgeons, interviewed them. And then my husband and I drove to Dallas for me to have excision surgery. And then I just informed my IVF doctor after the fact, who my second IVF doctor was more supportive. He was like, yeah, that's reasonable. If you want to do an X slap at this point in your journey, like go ahead and do it. He wasn't like, you need it, you have endo, but he wasn't against it. But I had to go like learn what excision is, learn
Mhm.
how to look for a qualified endo excision specialist, robotic excision, more than 200 cases a year, not a standard OB. I'm familiar now with like even like the Nook Facebook groups, which my surgeon wasn't Nook qualified, but I also learned that that's not necessarily like a qualification that you have to have. All of this stuff, which maybe is even like going over the head of some listeners, but I had to do all of this research, find a surgeon and go get the surgery myself. And I'm just like, and then I had endo and I was right. And all of my biopsies came back endo, 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 endo. And all the doctors who told me that I didn't have endo, I was like, well, I just got it cut out. So it was all up in there. But I just thought to myself, like, if I was somebody else without a medical background and that
Mhm.
first doctor says, you don't have endo,
Yep.
and then you just stop and you live
Yep.
in pain and you wonder why everything hurts, or you wonder why you can't get pregnant, or even in the case of IVF, like why your embryos aren't implanting and everything's super frustrating. And you keep going down other rabbit holes and trying to solve other problems that don't exist because you haven't diagnosed and figured out the endo. And the number of women who have told me, I don't have endo. My doctor did an ultrasound and said, I don't have endo. And I'm like, so your doctor didn't even tell you that the only way to definitively rule endo in or out is a laparoscopy surgery, period. MRIs cannot rule out endo.
CT,
Ultrasounds
any of them.
cannot rule out endo. Palpation exams cannot rule out endo. None of those things can rule out endo. And there's so many women who aren't even aware of that because their providers didn't even tell them that part either. So now, yes, on my platform, I talk about endo and like scream it from the rooftops because so many people are in my shoes months and months ago. They get told that they don't have endo and they just stop. And then they just continue to suffer because they might not know how to advocate for themselves or what to do next.
Yeah, I think another thing, I love everything that you just said, and I think it is so empowering and really important for listeners to hear that if a doctor tells you that you don't have endo and that through the ultrasound what they find or tell you is cysts and that they will take care of themselves, go see another doctor. Go do the research and find an endo specialist because I don't know, don't take this for what is, but I am about 98% sure that people who are told that they have cysts and that the reason why their pain is amplified during that time of the month, it's not a cyst. it is endo, because that is what I was told my entire life. Oh, you just have cysts. They'll take care of themselves. So, a the strength that it takes to like go and do your own research, it's exhausting, but it's needed. And I think you touching on that and telling your story, I really hope that resonates with listeners to know that like go and see more than one doctor. Get
Yes.
2,
Yeah.
3 opinions before you make any type of decision. And I wish more people did that because like you said, like if your first surgeon's like, ultrasound, we don't see anything, you're fine, and you believe that, but your body is telling you differently, listen to your body.
Yes. Yeah, and I know it's laborious. I won't lie, like it's laborious, it's time consuming, and people might be like, I don't want to pay for all those consultations. But at the end of the day, if you actually have endo, like endo comes with a
Mhm.
lot of pain, a lot of discomfort, potential infertility.
Mhm.
Like it's your body, it's your life, and you know your body best. If something's not right, go through the motions, like do the work, because I was so thankful to get an answer after all of that, because I felt like I was no longer crazy.
Yeah,
Like
yeah.
all of the, and I even like told my husband after the fact, because he mentioned, he was like, yeah, you've been really like worried about your belly for a while. And I'm not somebody that's hypercritical of her body. Like I'm comfortable in my skin, good relationship with food, good relationship with exercise. But after having a baby, I was like, is this just postpartum? Or, and I kept thinking, like, can I not cope with having a baby and my body
Mhm.
changing? I was judging myself. I was wondering if I had body dysmorphia. Like, I was wondering why intercourse was uncomfortable. I was also blaming that on having a baby. I was pretty much blaming everything on
Mhm.
postpartum and motherhood because I just couldn't come up with another explanation. And I was gaslighting the heck out of myself, only to find out that everything was abnormal. And I was right. And I was right to be uncomfortable. And I was right about my endo belly. And I was right about painful intercourse. And all of that stuff was because of endometriosis, not because I have like a mental problem. And
Yeah.
had I not gotten that information, I would still be here. I had my ex lap like 6 months ago. I would still be here thinking that I was crazy or that there was a problem with the anatomy of my stomach, or, who knows what crazy things that I'd also be doing and trying to change the way my body looks or feels if I didn't know that it was endo.
Totally, totally. And for you, I mean, obviously through what you do for a living now, like fitness and strength has always been a big part of your identity, and movement. So finding out that you had endometriosis, how did that change your relationship with movement?
I think it like made me realize that my habits were even more important. It's my first, thankfully I've been pretty lucky in my health journey. It's my first chronic illness diagnosis. So I
Interesting. Okay.
I I did not have any other chronic illnesses. I'm 35 years old now, and I got diagnosed a month before my 35th birthday, and it was hard, like absorbing the news that you have a chronic illness. I kind of felt embarrassed at first. Maybe there's something wrong with me. Oh, I'm not as healthy as I thought. Oh, I'm a health and fitness coach, but I have a chronic illness. Is that like, am I a hypocrite? Just like when you're first absorbing the news, cascade. There's this cascade of thoughts. And then I realized, like, no, having endometriosis doesn't mean that I don't take care of myself or that there's something wrong with me. We don't even really know why it happens. We have these like theories
Exactly.
and potential reasons, but to this day, nobody can tell you definitively how you get endo, when
Mhm.
you even got your endo, when it developed in your life. And so then I just realized, okay, there's things that are out of my control, like endo.
Mhm.
Endo is out of my control. I will live with it forever. I might have more lesions or less lesions at any given time, but it's a chronic illness. And even if I get it excised, it will grow back. And I need to understand that that is not something that I can completely control. So, what can I control?
Yeah.
What I put in my body, how much I move my body, how much muscle I have, how healthy my heart is, how clean my blood vessels are,
Mm.
how good my insulin sensitivity is. Like there's a lot about my body and my health that I can control and
Yep.
I can directly influence with my habits. Let me put my focus there because, especially as somebody with a chronic illness, endo has triggers.
Yep.
And the more I take care of myself, the easier of an experience that I will have with endo.
Yeah. And it's not to say that like making all those changes or, you know, doing all of that is going to take away any of the flare ups or endo belly
For
or
sure, for
fatigue,
sure.
but it definitely is another tool in the toolbox to say, okay, like there's a link between what I eat and my flare ups. So let's be more
Yes.
conscious about what I'm putting into my body. And it's just a way to help treat symptoms.
Yes. Yeah,
Um,
you can't like out diet
right.
endo. And I've been a health and fitness coach for 8 years, and all the symptoms that I just described to you occurred during this time where I was already walking and I was already lifting.
Yeah.
But maybe more processed food, maybe more sugar, maybe more alcohol
Mhm.
previously, and I did start to realize that certain things were triggers, and like endo is really uncomfortable.
Yeah.
If I can just eat less Chick-fil-A and
It's
be
just
more
so sad to
comfortable.
see.
I know. I still enjoy indulgences, absolutely, but just a little bit less, because
Yeah.
sometimes the toss up between how good that tastes and how, it might affect
How you
my
feel.
endo, I'll go ahead and choose to go home and eat the salmon and rice instead.
Totally. Um, so I wanna I wanna shift a little bit into a topic that we've sort of already been talking about, but that I relate to with you very much. But before I do, I think there is a congratulations in order for you
Yes.
because you just let your community and know that you and your husband are expecting. So
Yes, yes,
that is really
yes.
exciting, and so
Finally, yeah, thank
congratulations.
you.
Um, but this topic is, it's still touchy for me, but endometriosis and infertility are often very much intertwined. And I personally think it is something that needs more attention and more conversation around. Because when I was going through it, every story that was either on the Today Show or anything that I was watching or books, it was like the person that's was going through the journey and in IVF would talk about how difficult the journey was and the strain it put on them and their relationship. But guess what? Like it was all worth it because at the end of the day, like I'm holding a baby. And there was no one talking about women who went through that journey and didn't end up with a baby. And I no longer fit in the IVF support groups that I was in. And then I was looking for support groups locally. And the only one that I could find in my area was like a grief support group for people who had lost like a loved one. And I definitely didn't feel like I belonged there. And I had no one to talk to about the nights I spent crying and feeling like so shameful. And what's the point of having this body if it can't do the one thing that it's meant to do? And I remember a really difficult conversation when I called my mom and I was uncontrollably crying, apologizing to her because I couldn't make her a grandmother. And I felt like I hated my body. I hated that not only did I fail myself, but I felt like I was a massive failure to my family. And I never found those stories being told, which was part of the reason why I wanted to start my podcast was because I hate how society sugarcoats everything and because they don't wanna touch on a uncomfortable subject or the uncomfortable side of a subject like infertility, so they just don't do it, and then women like me and whoever else is listening, going through or went through IVF and their journey ended without a baby, where is that being talked about? That shame, guilt, because I mean, you already have it when you're going through IVF, but what was the journey like for you?
So I haven't had that exact experience, obviously, because I have been fortunate to I have a two
Thank
and a
God.
half year old son, and now we're expecting again. But a small way that I can kind of relate to that feeling. So in 2021, I had a uterine septum cut out so that
I
I
had one
would,
too.
yeah, okay, which is
Yeah,
kind of linked to endo.
yeah,
So my husband and I were trying for 8 months or something, unable to get pregnant. People were like, this doesn't make sense. You're young, your hormone levels look good. Got referred to a fertility specialist and immediately diagnosed with a septum, which, for those who don't know, it's like a wall of tissue that separates your uterus into two cavities. Think about the septum in your nose.
exactly.
And so it basically makes it very difficult for an embryo to implant and for a pregnancy to develop. And depending on the severity of your septum, it can have like an over 90% miscarriage rate.
Mhm.
I really, really struggled with that because you're born with it, by the way. It forms when you're in your mother's belly. A septum is formed. So, like before you have even taken your first breath, you have a septum. And I was like, I'm the oldest of four kids in my immediate family, but like 10 in a, Brady Bunch divorced and remarried family. And then I was a nanny and a babysitter my whole life growing up. Then I went into labor and delivery nursing. Like babies was like the focus of my whole life. And then
In your
I found
DNA,
out that I
literally.
was born with a uterus that can't have babies. And I
Yeah.
I had a really hard time with that because I was like, am I not meant to be a mother? Am I not meant to have kids? Like, how could my body do that to me? I felt very disconnected from my body. I felt very angry with my body. And I also realized if I wasn't born in the decade that I was born at the time in history that I was born, I would just never, there's no options. Like
Yeah,
today,
yeah.
like that you can get them removed, you can get septums treated. But I was like, oh my gosh, if I had been born 100 years ago, like probably wouldn't even have the technology to diagnose one, to even
No.
figure out that that's what's going on in there. And so like that was really hard for me to like believe that I was still meant to be a mother, even though my uterus was, born like that. And
Mhm.
even then going through infertility, I have definitely questioned many times, like, I don't understand. I want a baby. Like, am I not a good mom? Am I not a good person? Is this karma? Like literally, I was like, if I wronged too many people, out in the world. But what I have definitely come to realize, not just through my own experience, but through connecting with a lot of women with stories like yourself, is that like infertility does not
But
discriminate.
yes,
It
yes.
is not because of anything that you have done.
Mm.
You can look at the healthiest people in the world. There's no like stereotype that's body weight or medications or drug use or lifestyle. Like, no. There's literally like no connection between practically what like a person does and then their likelihood of having infertility. Some of the people in the world that I would just never ever expect in a million years have some of the, hardest infertility journeys that I've ever seen. And I, just always try to support women whenever they're going through a lot of that like shame and guilt,
Mhm.
that I know it's like so hard to let it sink in, but hopefully it does eventually, that it's truly not your fault. It's not
Yeah.
your fault. You didn't do anything wrong. It doesn't mean that you're any less of a woman or a person, or that you have any less value as a person, just because like your uterus and your ovaries maybe don't behave like your neighbors. But even with that said, it's an extremely like excruciating journey to go through when you're the person experiencing it. And
Mhm.
I, like I said, I can't even relate to that to the full extent. So I can't even imagine.
So I mean, I never knew anything about, having a septum grow or whatever, but, like, the fact that I from 13 when I first got my period and then, like, started having to have, like, yearlies or whatever, up until I was 37 when I got my diagnosis. Had my surgeon not ultrasound endo first, I had nobody ever told me that I had a septum growing in my uterus.
You're
Like,
never
so
checked for it unless you're trying to have a
no.
baby. And unfortunately, women who have septums usually only find out after experiencing multiple miscarriages, which is such a terrible path to get there. Or like endo surgery, or another reason that's equally challenging and
Mhm.
terrible.
Yeah. So make sure anybody who's out there, like, make sure to ask about that because it 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 was new to me. I had no idea.
I had
Um,
never heard of it in my life. I think it's only like
so weird.
2% of women in the world have a uterine
Yeah,
septum. So
which is so
to possibly
interesting because my
reassure people a little
sister
bit,
has
there's a
one too.
98% chance that you don't have it. But,
I don't.
if you're somebody that's experienced one or more miscarriages and you've never carried a baby to term, like a septum can be diagnosed via a water or saline ultrasound. It is not painful, it
Mhm.
is not invasive, there's no cutting, there's no anesthesia required. It can be done outpatient in your doctor's office. It's very easy. And so it's a good box to check.
Yeah, for sure. Something I really admire about you is how your definition of health and how it's evolved in a way that, like, feels natural and good for you, and so here you are going through all of this and then building this incredible community, DLD Nation. So, how did you do that while you're going through everything you're going and, like, your community is massive. So, like, did your personal journey shape the way you built your program?
Yes. Yeah, it definitely did, in the sense of becoming a little bit more empathetic and realizing that health is not like one size fits all and there's not one definition. When I first got into health and fitness when I was like 25, 26, I got very strict right away. Like, no processed foods. If you eat sugar, like, how embarrassing for you. Just like, oh my gosh, people who drink like full strength sodas, what are they doing
You would
with
hate
their
me.
lives? I just like thought that everything needed to be like that. You needed to be like 99% consistent to be healthy, like consistent in, health behaviors. And through my journey, I started to realize that it's not healthy to stress about every single thing that you're putting in your mouth. It's not healthy to stress about exercising or rescheduling a workout. Like, it can actually get to a point where being healthy can become a problem if
Mhm.
you're like absolutely terrified that, like, if you ever have a piece of rotisserie chicken, your life is over. And there are
Totally.
just like, some of the conversations and stuff that I see online, people don't know what to eat in the grocery store because it all has to be organic and it all has to be wild caught and it all has to be air chilled, not moisture chilled. And who has the money for that? One,
Yeah.
like, you need like $500 a week if you want to like follow all of these guidelines from the health gurus. But also, it's kind of just no way to live. I think
No.
like having a relaxed but healthy, relationship with nutrition is key. And like now I really subscribe to the 80/20, and that's what we teach our clients, which is
Okay.
80% of the time strive to eat whole, minimally processed foods, fruits, vegetables, legumes, like, potatoes, sweet potatoes, foods that you can see in their whole form. They haven't been heavily processed. And then 20% of the time, keep yourself sane, live your life, have the glass of champagne on New Year's or at the wedding, like have the slice of birthday cake on your birthday, hit the drive through. Like, we all do it sometimes, and
Allow
like
yourself.
give yourself the flexibility to enjoy those delicious foods that we have access to. But just
Totally.
make sure that that's not the majority of what you're putting in your body, because if you are more 80/20 than 50/50, let's
Mhm.
say, you're probably just going to feel better and you're
Yes.
probably going to be healthier and you're going to have a lot lower risk of chronic illnesses. And so, yeah, kind of circling back to your original question, I mean, going through my health journey made me realize the impact of stress
Yeah,
and worry and trying to be perfect at everything. And that's just perfection is not a goal that you ever want to chase. And so now I really work more on helping women be healthy, but be kind to themselves and be reasonable. Like, be reasonable with what a normal day to day life looks like, especially if you have kids or a demanding career.
yeah,
Like, you don't need to be spending $1 million at the grocery store and cooking like a professional chef every day to feel good in your body.
totally. And you started DLD, you were first a one-on-one coach, and then you built this, incredible community and involved other coaching and everything like that. But as a one-on-one coach, I would think that you'd have to, you know, set some boundaries for your own energy and your own way of living and making sure that you're still taking care of yourself while also helping other people. So, and I've learned, and I still struggle with, like, my definition of strength is thinking like, "Okay, I just push through." And I think that's because we've grown up in a society where strength means not showing any weakness and, you cry, you're weak. So, how do you set boundaries for yourself with your clients?
I will say nursing really helped with that compartmentalizing. I and that's like, just maybe the luck of my life path, because as a nurse, it is life and death, and labor and delivery can be beautiful. And I think that everybody pictures it as like, you just like snuggle newborns all day long. And there are beautiful, amazing days that are just like filled with like newborn cries and newborn baths and swaddling and, helping families take photos. There are also many days that your job that day is helping a woman through the worst day of her life and delivering babies that have already passed in
Yeah.
utero and the aftercare thereafter. And so I did that for 5 years.
How do you
And
not take that home?
it at first it was harder. Like, I feel like, like even you will probably get this in like healthcare providers, as like ICU nurses, people that see a lot of like death, oncology, providers probably know. You just get to a point where the job kind of teaches you how to compartmentalize. It's not that you don't care. It's
Yeah,
not that you become cold and jaded. You just have so much exposure to it that you learn to control your nervous system more around it. And it's not like it's another day in the job and you don't empathize with people, but when it happens over and over and over and over, it takes a lot more to stimulate your nervous system. It takes a
yeah,
lot more for me to kind of like lose control and to take stuff home like too deeply where I can't like function at home. And so, even though like in one-on-one coaching, I am dealing with people's health, it's not life or death. Like, my previous career was life and death,
mhm,
and life and death of like mothers and unborn babies. And so now, even if I have clients that are having a really hard week and emotionally like dump a lot on me, I feel like I just have a really high capacity to cope with that because they're not dying.
yeah.
I know that sounds like,
No, it
may
makes
sound like
sense.
really extreme, but just when you've had that previous career, I'm like, tell me about the loss in your family. Tell me about the divorce. Tell me about the struggles with your kid. Tell me about all of this stuff, because like, as long as you have a pulse, I can take
Yeah,
it.
yeah. So tell me what's next for DLD Nation. What do you have coming up? What's going on?
Well, it's New Year's, so it's a really good time to like get lots of people going on their health journey. We're in a really good phase of stability where like I spent so many years always trying to kind of reinvent the company and like
Mhm.
reinvent the next offer and trying to grow in all of these directions. And one thing that at least I've realized personally is that like you want to find the main thing that you're really good at and just strive to be the best there. Put more and more of your attention there, as opposed to creating all of these offshoots and then thinking, well, like, now could I do this or now could I do that? Could I do apparel? Could I do supplements? Could I do groups? Could I do
Yes.
in person events? I've done a lot of those things, and some of them were fun. But at our core, we are really, really good at one-on-one coaching. And right now, I'm just focused on like helping the coaches be even better coaches, helping myself be even better at coaching, communicating to people about DLD, getting them into the community, making sure that their experience is better here. We've improved community chats and some resources for clients. And so, kind of all of my energy and attention and focus is just like making what we already do well bigger and better, if that makes sense,
Totally.
as opposed to being like, okay, now DLD is going to go into like food products, like
Totally. Candles.
yes. I like staying in our zone of genius and just being the like, trying to be the best at something. And like
Yeah,
that's my goal. Like I think that our coaching, I'm not even speaking about my personal coaching, like our coaches are exceptional. And I love that feeling. And I love saying that. Like if somebody asks me honestly, like if I come become a DLD client, will I have a positive experience? I am like, hell freaking yes. Like the people who come into this program have their life changed. And I'm just like obsessed with making that even truer every
yeah.
day.
It's so incredible. I also think like your job is not only to be like, okay, let me help you on your lifestyle change in terms of exercise and nutrition, but like you guys are like a therapist too.
There's a lot of like life coaching. We always recognize, like our scope of practice, right? You have to be respectful of that. However, if you're a health and fitness coach, you are life coaching. Absolutely. There's so much mindset, motivation, like aspects of mental health, while leaving the true therapy, of course, to like licensed professionals. But yeah, it's not like all of the conversations are just about like what you had for dinner and like your workout that day.
No, I mean, I know for me, like my trainer, I'm like, I just dump everything on him and I feel so bad because I'm like, okay, let me tell you about what's going on with me.
My clients, it's like kind of like, your hairdresser or something. I
Exactly. I
know
was
things about
just
my
going to say
clients that
that.
like their husbands and their best friends don't know about them. And it's just like so fun to be their safe space. I can't tell you the number of my clients who've been like, they'll send me a pregnancy test and be like, I haven't even told my husband, but I
Oh
had to
my
tell
God, I
you.
love that. I love that so much. Okay, so
Yeah.
before we wrap up, I want to play a quick little game with you, a little rapid fire game. So, one thing that brings you comfort on hard days,
My son, for sure.
a daily affirmation that helps you to pump yourself up.
I'm a good coach. I'm doing a good job.
Okay. One boundary you're proud of yourself for holding.
Hmm.
Mm,
Saying no to social plans when I really don't want to do it. If it's not a hell yes, it's a no.
I
I'm
love that.
introverted, so
I love that. I always tell people no is a full sentence.
I love that. Yes.
Okay. And one piece of advice you would give to your younger self.
Ooh, don't take it so seriously. It'll
Oh,
all work out. Just
oh,
I wish I could help her relax a little bit
right.
more and take a deep breath.
I love that one. That's, oh God. I do. I wish I could go back in time and just like give myself a big hug.
Yeah. I think our brains are just wired that way. In high school, you think that everything that happens to you is the start or end of
End of
your
the world.
life.
End of the world. I literally just
End of the world. Yeah.
like that boy that didn't, hold your
Yeah. Like,
hand.
honey, don't give it another thought.
That dude is probably like holding a sign out to come to Chick-fil-A. Okay. Don't worry. Um, okay. I think you're amazing. I really would love to have you on because I think there's a whole other aspect of your career that I personally want to talk to you about, but like you do a lot with menopause. And so I would love if you would come on another time and like talk menopause because I'm in menopause and there's a lot of people that follow me that are too. But
Yeah.
that's for
No,
another
this has been fun. I
conversation,
love that.
hopefully. Please let all my listeners know where they can find you if they're interested. And please, you guys go. DLD Nation is so fucking cool.
Well, thank you. Yeah, by Instagram, Dala loves dumbbells, DALA loves dumbbells, exactly how you would think it's spelled. And there's a link in my bio that'll take you all the places that you might want to go. But also, I'm really responsive in the DMs. And so
Yes,
if
you are.
you send me a message and you have any particular questions, I can give you some free advice or, guide you to what you might be looking for. We have lots of good resources. And so,
Amazing.
yeah, happy to connect.
Amazing. Okay. Thank you so much. Stay on so I can talk to you before we end. But for everybody else, thanks for joining and tune in next week for an all new episode.
Thank you for having me.
Bye. All right, guys, that is it for today's episode of Endo Warriors. Thank you so much for listening. And please don't forget to hit follow, leave a review so more Endo babes can find us. And tune in next time for a brand new episode. Bye.